While in these classrooms, they develop intellectual competencies, imaginations. It is the field which exposes them to social realities, where these abstractions, these theories, concepts, they come alive.
One of our students said, "Field is where theories breathe."
Field practice is a carefully designed pedagogical approach to public health education at Azim Premji University. We want our potential public health practitioners to have a grounded understanding of health and the diverse context that shapes people's health and well-being.
We have 4 field components in the 4 semesters of MPH program, which together accounts for 34 out of the 80 credits of the program.
So in a series of very carefully designed field practice interventions that run throughout the program, in each semester as well as inter-semesters, the first component is Field Practice 1, immersive engagement in the communities. So in this semester-long engagement, students in groups of 3 or 4, they spend 1 day each week in an urban informal settlement of Bhopal. Their access into these communities is mediated by our field partner organizations. And while across different courses in semester 1, they're exposed to concepts like social determinants of health, embodiment, structural violence, medical pluralism, it is the field where these abstractions come alive, where people feel, they experience this complex interplay of social determinants.
Students try to understand the communities by engaging with the locals and developing a social map. And they get to know the spatial realities and the social realities of the community through this exercise. In the next unit, after they have had sufficient in-depth conversations with families, they share with us a very humane story that tells us what communities feel and think about health as a concept. The second course is all about discovering the principles of primary healthcare as enunciated in the Alma Ata Declaration in the work of a primary healthcare organization. What community participation actually means. How does the aspiration for equity transfer into actions? How is intersectoral coordination actually practiced? And what do we mean when we say that solutions in healthcare have to be appropriate? So to what extent these organizations who have been working for decades on the ground are able to follow these principles? This is what students try to discover. So at the end of the posting, they come back with a lot of information, but they also bring back a lot of insights into this approach of primary healthcare. The third field engagement brings the student up and close with the government health system in Bhopal city. They are largely anchored in an urban primary health center, but they also visit district hospital, NRCs, early intervention center, district malaria office, district TB office, etc. They explore the exhaustive reporting and recording system that exists in a block. Through this engagement, they get a taste of the reality, how health programs are actually run on ground. They get to know the scale at which government health department functions and its strengths, and they also come to know the challenges that government health staffs face. The last field component covers the entire second year of the MPH program. So in the third semester, students choose a broad area in which they want to work in. Then they choose an organization which is working in that broad area, and thereafter, together with the organization and their faculty mentor, they narrow down on a topic which they would like to work more intensively on. Thereafter, they develop a proposal and run it through the institutional review board. And once all this is done, they set off for their 4 months of field work. After reaching the field, they pilot their tools, start collecting data or working on the project that they have chosen with the organization. Along with being a researcher, they also try to be a part of the organization and learn the professional work ethic and the discipline of working in a formal space. After they return back to the campus after the 4 months, they engage more deeply with the data that they have collected. They analyze it and they prepare a report which contains their findings. And this report is kind of a culmination of the learnings that they have had in the classroom and in the field over the last 2 years.
While in these classrooms, they develop intellectual competencies, imaginations, it is the field which exposes them to social realities, where these abstractions, these theories, concepts, they come alive.
I cannot put it better than how one of our students said, field is where theories breathe.